Good morning. Good morning. Welcome to another edition of Sunday Morning Transplant Coffee Talk. I am your host, Steve Belcher. Good morning, everyone. Again, I would like to ask for thoughts and prayers for my partner, Tamika Moore, and thoughts and prayers for me as well. I'm going through life's problems and I'm dealing with them, but always would love some thoughts and prayers. This morning, we were supposed to have Rosemary Atanga from the Atanga Kidney Foundation. And for the last 2 hours, I kid you not, we've been trying to deal with behind the scenes technical difficulties in getting her on and getting the show started. So she's still trying. We're still trying to get her on. But if you're invited to the show, when we ask to do test runs, we don't like to do them the day of to show, because things like this could happen. We always like to do them days before to make sure we don't run into any snags or anything like that. So, unfortunately, if she doesn't come on, that's okay. We can always reschedule her, but we always got time for life-saving information that people should know, especially those dealing with kidney disease, diabetes, or hypertension. So, um, we're working behind the scenes to get her on. Until then, we're going to talk about taking care of your feet because it's important if you have diabetes. And we're going to talk about the arteriovenous fistula because that's your lifeline. And I think that's more important than any broadcast is your lifeline to dialysis because if not taken care of properly, you can die from it. I've known patients during my um, course of work that um, they were at dialysis and they bled for maybe about an hour holding their site. And then they stopped bleeding, taped them up. But when they got home, when they fell asleep, they bled out. Has anyone who's listening ever heard that happening to a patient that their fistula burst and they bled out and while they were asleep and they died because of the loss of blood? I mean, that's happened many a times in dialysis. And I heard that throughout my 33 years. So the first thing I'm going to cover is taking care of your feet. That's very important as well. You may know some people who may have had diabetes or have diabetes that, one day they noticed they had a sore on their foot walking around with no shoes on. That's why we encourage patients who do have diabetes to not to walk around with no socks on, because if you have decreased sensation in the bottom of your feet, then you won't know if you cut your foot. And if you cut your foot and you have a decrease in blood flow to go down to heal that wound, that's where the gangrene sets in, and that's where the amputation starts to happen. And then it starts out, if you're not mindful, it starts out with one toe, then it starts out with two, then all of a sudden it becomes all your toes, then half your foot, and then below the ankle, and then it doesn't stop till it gets either above or below the knee amputation. I mean, it's ridiculous. I can't tell you how many people I've seen unnecessarily have amputations because they had a cut either on their finger or on their foot and didn't pay any mind to it, and it got infected. And next thing you know, you can see dead tissue. So let's get into this. I'm giving you information again. Now, how many of you go to Fresenius? Okay. How many of you go to DaVita? I- they take up 70% on the market. And so let me tell you why I voted yet. Well, I didn't vote, but my um, support for Proposition 8 and why I do what I do and why this is a money thing. It's all logic. It's all logic. Think about it. If you go to Fresenius Davita, now these are big companies, so you may be going to clinics all over the United States. So I don't know where you may go, but let me just tell you this. How many of y'all seen this book? Now it's from Fresenius. I'm gonna let you see it. Y'all see that? You see that name? So I show you because that's what I'm going to teach out of. But if you never seen that book and you diabetic and you go to Fresenius, why haven't you seen this book? Why haven't you seen that book or anybody talk to you in the clinic about taking care of your feet if you got diabetes? This is what I'm saying. That's why, see, Bubba even answered, nope. And see, Bubba, I acquired this throughout my years um, doing this, but I didn't know the reason why. I just kept it. At the time that I got this book, I just kept it and put it aside, like all the tons of information I got. But now I see it. Now I see the reason why I had this information so I can tell y'all, because surely the company is not telling you. Your healthcare givers are not giving you information or education if you have diabetes. And if you got diabetes, then you at risk for amputation. That's why you got to take care of your foot. You may not know that. So let me start. Taking care of your feet. It's important if you have diabetes. Nerve damage in diabetes may prevent you from feeling an injury. That's what I said in the beginning. If you're walking around with no shoes on and no socks, and you got nerve damage, and you're not aware that you got nerve damage because you're not even thinking about it because you don't know you have diabetes. How, if you don't know you have diabetes, how would you know you got nerve damage? And so you're walking around, you don't know you have diabetes, you don't know you have nerve damage, so you can't feel sensation under your feet. So you will be walking around with no shoes on outside, whatever. You got glass outside, you got many stuff. And if you stick your foot with a nail or glass and you cut it and you don't have any blood flow going down there like it should, a decrease, then it's going to take longer to heal and put you at more prone to infection. But a lot of people don't see that. So again, nerve damage in diabetes may prevent you from feeling an injury or feeling hot or cold temperatures. That's another thing. If you get in the bathtub and the water is too hot and you can't tell the difference, you can burn your foot and cause a blister. And from a blister, it can open up. So follow the tips we have provided to help prevent foot problems and amputation. So let me just say this. They have information for you that you haven't seen. And in this information, it says, follow the tips we have provided to help prevent foot problems and amputations. And if you don't have the information, how are you going to prevent foot problems and amputation? That's why we're here. That's why we ask for the donations and the support to keep doing this and to make people aware. This is the only way we're going to stand in front of kidney disease. I promise you, if you go by these tips that these companies put out, because they have to put them out according to Medicare, you know, they have to, but they can have a box of them stacked up and not even put them out. So if you don't know, you're at greater risk of getting uh, foot problems and amputation. And for some of you, it may already occurred. Okay, number one, bathing. When you're bathing, so if you have a family member, people watching and know people with diabetes, you got a family member, sister, brother, cousin, uncle, aunt. Take these tips and educate them. The time of being silent and feeling guilty and wrong and mentioning stuff and feeling that you're out of place and saying something to somebody, those days are over with, because we seen what those days led to: a high rate of diabetes, kidney disease, and hypertension, which caused a proliferation of kidney dialysis centers, thousands of them showing up in urban communities across the United States. This is no joke, people. I advise you to share this information, to teach other people, to spread this awareness so you can prevent either yourself or your loved one or friends from going down to this road of diabetes with amputation, high blood pressure, getting strokes, um, and other complications from that, and ultimately getting kidney disease. So it's a triple whammy. Okay, so let's go ahead and start. When you're bathing, make sure you wash your feet daily with warm, soapy water. Again, make sure you wash your feet daily with warm, soapy water. Number two, dry your feet really well. Get a towel, not a wet towel or one that you use for your body, but get a separate dry towel and dry your feet really well, especially between the toes. That's important because fungi develops between the toes, because that's where a lot of the moist resides. And so that's why they encourage people to change socks throughout the day, wear cotton socks. So that's important. Dry your feet really well, especially between your toes. Do not soak your feet. If you got diabetes, again, do not soak your feet. And it's so important that they have it highlighted in black and in bold letters. So that must really mean that's important. Do not soak your feet if you have diabetes. It causes dryness. Again, soaking your feet causes dryness. It's important if you have diabetes. Do not, I repeat, do not check water temperature with your feet or your hands if you have lost feelings in those areas, because you may burn your skin. Again, if you lose your sensation, and if you try to test the water, if it's too hot, you're going to burn yourself. Use your elbow. Again, use your elbow, or better yet, ask a friend or family member to check the water temperature. Again, do not check the water temperature with your feet or your hands. Either use your elbow or ask a family member or a friend to check that water temperature if you have diabetes. Number two, look. What I mean by look, as you are putting on your shoes and socks each day, check your feet for dryness, cracks, redness, corns, calluses, blisters, sores, or swelling. That's very important. And if you can't bend your legs up to see, try getting a device that has a mirror with an extension on it and use that. Put the mirror down. If you can get a big handheld mirror, I got a little one right here, but you use something like this and put it under your feet and look down. and then you'll be able to see up under your feet. And again, check for dryness, cracks, redness, corns, calluses, blisters, sores, or swelling. Check the top, bottoms, and especially between toes. If needed, use a mirror or ask a friend to help. And this is for people also who are older and may have a decrease in vision and they can't see. So that's why they say ask friends or family, or even better yet, use a mirror, and hopefully you'll be able to inspect the bottom of your foot for uh, these conditions. Tell your doctor or dialysis staff if you notice any problem. Be safe, not sorry. Now, I used to work for Fresenius, and we used to, and I will be honest with you, I'm just going to be honest as far as myself, and I know a lot of nurses as well. I mean, we used to hate to do foot checks. I mean, now I could sit back and laugh about it, but I mean, it's not funny, but we used to hate to do foot checks. Now, just imagine all types of people come to dialysis. I mean, mental health, all types. And so you got people, homeless people, um, people who don't wash, people who do wash, people who take care of themselves, people who don't. I mean, this is just the reality of life. And when we used to have to do foot checks, they give us these little um, kind of like stick things about that big, and you can prick the person's foot and ask them if they feel it. But I mean, let me tell you, and this is real. You know, when we used to take off a lot of patients' socks, especially older patients, I mean, that's where you see the disease in full effect with amputations. Patients got two toes, three, or the big toe and the small toe, and the toes in the middle are missing, or they missing the great big toe. Man, I can't tell you how many patients that I come across. You know, I don't want to say thousands, but I mean, over a 33-year period, I mean, you have to wonder how many, patients. Um, you should get your feet examined by a physician or podiatrist at least yearly. Okay. Number three, lotion. To prevent dryness, use lotion on your feet daily. That's very important. I recommend using a natural lotion. I don't have any or endorse any in mind, but I wouldn't use the commercial lotions because of the chemicals that they have in these items. I even maybe instead of lotion, vitamin E, maybe shea butter, natural stuff for your skin, not these commercial items that they have that clogs your pores and you don't know what's in them, and they got the different chemicals that can you put these lotions on, they can what's the word? They can seep through your pores and get into your system. A lot of people don't think about that. Just the other day, let me just share this education moment that I had with a patient. I had a patient, and I saw she had like cold sores, but they were cracked and they were open on both ends of her lips right here. And you could kind of see a little bit of her, the tissue, like if it was a cold sore. So I was like, how did that happen? And she said that the physician told her it was because of her phosphorus, I believe she said, or calcium, I don't know. But she told me she was putting petroleum jelly on it. And I literally jumped out of my shoes. I said, what? Petroleum jelly? Vaseline? No. And for most, if any patients are out there that are using petroleum jelly, Vaseline, I strongly, I strongly encourage you to stop using petroleum jelly Vaseline. And the reason why is petroleum oil. So that's, the petroleum that goes in the airplanes and the fuel, that's a byproduct. And so we're putting gobs of that stuff on, and it's clogging up your pores and it's seeping through. Petroleum. Think about it. Petroleum that you put in jet fuel going on your skin, let alone putting it on the cracks of your mouth. I told her, stop that immediately. As a healthcare advocate and educator, I told her to stop that immediately. And I went to the room and got her some triple B ointment that the clinics have in these packets, these single packets, and gave her multiple packets. And then I told her, look, well, first, before I did that, I told her to go buy some Carmax or use Neosporin or triple B antibiotic, Batracin. And then I said, wait a minute, I'm not going to have her go out and buy that, spend her money when we got these small packets in a box and nobody's using them. No one's passing them out. So I go and get them and give her a couple, well, more than a couple. So hopefully it will heal her up. But again, people, I got on petroleum because it talks about lotion. If you use lotion, use a natural lotion. It may be a little bit more expensive, but at the end of the day, the life you save will be your own or your feet or whatever. So, two, avoid perfume lotions. Again, that goes back to the commercial lotions because a lot of that has, scent, smell, perfume, and a lot of people don't think about it. Just think about the thousands of people that uses these products and don't know they have diabetes. Thanks for tuning in, Tootie. I appreciate that. Peace and blessings to you. Just think about the thousands of people who don't know they got diabetes and using these products. It's making the situation a lot worse. And the companies are not telling you because they're getting your money. Ask your pharmacist for lotions that do not contain alcohol. Boom. Again, that goes back to what I didn't even read this. I'm reading this as, really for the first time, but I'm just thinking about it and saying it even before I get to it. And it's only reaffirming what was already in me to say to you, about the alcohol. So alcohol dries your skin out. So a lot of these lotions have the alcohol, has the fragrance, and we don't think about it. And we're putting it on our hands every day. Think about the thousands of healthcare workers that use scent lotions from Victoria's Secrets and all that stuff and putting it on. And then they're working with you, the patient. And let alone they may not be washing their hands, they just may be using a hand sanitizer. I mean, it's all ridiculous. And when you sit down and logically think about this, you got to ask yourself, like Arsenio Hall said, it makes you want to say. So apply lotion to tops, bottoms, and your heels. So again, you get some lotion, hopefully it's natural lotion, apply to the tops, to the bottom, and to the heels of your foot. To the top of your foot, the bottom, and the heels. Do not, I repeat, do not put lotion between your toes. It may build up and cause an infection. I repeat that again. Do not, and they got it in black, do not put lotion between your toes. It may build up and cause an infection. Number 4, your toenails. Trim your toenails straight across. File sharp pointed corners. So if you got sharp pointed corner toenails, you definitely want to file them. And they got this in black, what I'm about to say. Do not, I repeat, do not attempt this yourself if you have poor vision or nails that are thick. I repeat, do not attempt to trim your toenails if you have poor vision or your nails are thick. Because if you have poor vision and you try this, you may cut yourself, which may make the situation a lot more worse. It can go from worse to bad. And what I mean by bad is getting that toe cut off and then it's spreading down the line or up the line. It could go from your baby toe up, go from your big toe down. It could go between out. And then next thing you know, they're cutting the feet and then they go into the ankles. I mean, these guys don't stop and they know and they don't tell you what to do if you have an infection. And they tell you to keep it clean, but they don't really get into the nitty gritty of it. And then just think about the patients whose education level, won't allow them to understand these instructions. That's why those days are over with not sharing information. You have to share it. I mean, if you are a kidney warrior, you got diabetes, hypertension, it is your obligation to share with the next person who may be dealing with this that don't know, especially if you're educated and know this. If you're walking around out there with multiple degrees, you're educated, 12th grade educated, college educated, and you have this disease, kidney disease, whether it's stage 1, 2, 3, 4, 5, or you had diabetes, whether it's type 1 or type 2, or if you have hypertension and you're dealing with that and you're educated and you're watching this or you hear this or you see this, it is your obligation to share this information about foot care, diabetes, kidney disease, hypertension, awareness, prevention, and education. It's an obligation. Okay. Ask your doctor if you may need a referral to a podiatrist. So if you've never seen a foot doctor, that's another name for a podiatrist, is a foot doctor. If you've never seen one and you have thick nails, and you can't trim them down or cut them, don't try to cut them with no knife or anything like that. Go to a professional provider as a foot doctor or podiatrist and get that checked out. Seriously, because again, that can be the difference between amputation, getting infection. Because if you got long nails, toenails, it can breed bacteria under your nails if you're not washing up, keeping the feet clean, anything like that. So that's very important. And that's nothing to be ashamed about. Number 5, corns or calluses. And they have this in black. Corns or calluses may lead to more foot problems. After washing your feet, use a towel to gently rub any corns or calluses. You got to look at the words that they use, and they got gently underlined. Gently, not rubbing and really drying it vigorously, but gently rub any corns or calluses. Use lotion to soften the corns or calluses. They got this in black. Do not, I repeat, do not use over-the-counter corn or calluses remover. Let me repeat that again. Do not, I repeat, do not, if you have corns or calluses, and if you're diabetic, use over-the-counter corn or calluses removers. Never cut corns or calluses by yourself. See a foot doctor or podiatrist, which is another name, to remove safely. Okay? Don't attempt this on your own to cut off a callus. I'm sure some people have done it on their own, but if you have diabetes, poor vision, and you have corns or calluses, never cut them by yourself. See a foot doctor or podiatrist to remove them slowly. All right, I think this is important as well. Foot protection, very important. Foot protection. Wear shoes that fit, cover, and protect your feet. I'm going to say it again. Wear shoes that fit, cover, and protect your feet. Number 2, comfortable leather or canvas shoes with laces or Velcro are good choices. I'm going to say it again. Comfortable leather or canvas shoes with laces or Velcro are good choices. So if you're diabetic and you're wearing stilettos, that's a no-no. Or you're wearing these shoes that squeeze your feet at the top, mainly speaking, the women. And men, they got these shoes now where they're pointed at the top. And if you got diabetes, those are the wrong type of shoes to wear. Seriously. Um, some people will need special shoes or inserts, which is a covered Medicare benefits. So that's important to know. If you have a mom, a dad, a cousin, sister, brother that's on Medicare that has diabetes, and you think they may need some special shoes to protect their feet so they don't get amputated, because this is serious business, people. This is really serious. You need to know that if you need inserts or special shoes and you had diabetes, this can be covered by Medicare. So share this information, especially if you know someone that has diabetes type 2 or type 1 and they don't know this information about their feet. Because I'm sure nobody wants to get their feet, their toes cut off unnecessarily if they knew or could have prevented it. Avoid sandals and never go barefoot. Protect feet on hot sand or pavement. And that's very important too if you go to the beach and if you're diabetic. So this is important information, and I encourage you to share this any way you can. Any groups, Facebook groups that talk about diabetes, kidney disease, heart disease, education. This information needs to be out there because I don't see anyone else sharing step by step that help you with will help anyone with protecting their feet against diabetes. Check inside of each shoe for hitting objects or creases before putting them on. That's very important because something could fall in your shoe, a nail, a rock, or something like that, something that's pointy, and you put your shoes on and step on it, it can cut your foot. So that's very important, foot protection. Wear clean socks or stockings. No stockings with tight tops or seams which rub. Wear socks at night if your feet get cold. Break in new shoes slowly. Check often for redness or blisters. Do not put feet next to space heaters, car heaters, hot water bottles, or heating pads. Again, and this is in black, do not put feet next to space heaters, car heaters, hot water bottles, or heating pads. And look, this is very important, especially for seniors. For those of you who have mom and dads, grandmothers, aunts and uncles who are maybe 50 years or up, 60 years old, 70, 80, and they use a heating pad and they have diabetes, or they want to keep warm. This is very important that they do not use these items for a long period of time if they do, because it could cause blisters and open them up for infection. So first aid, this is very important. First aid. If you get a cut, scratch, blister, that should be treated right away. Right away, that should be treated. And how's that? Well, they say wash area with warm soapy water. Do not soak. Again, I repeat, do not soak if you have a cut, scratches, or blisters on your foot. Do not soak. Just wash the area with warm soapy water. The reason you want to soak, because you don't want to get infection in that open wound. Very important. Very important. Apply a mild, clear antiseptic to the area. Ask your pharmacist for product advice. Do not, I repeat, do not use iodine, mercurochrome, betadine, Epsom salt, or alcohol on these cut, scratches, or blisters. Again, do not use iodine, mercurochrome, betadine, Epsom salts, or alcohol. Cover open area with a dry, clean bandage. Again, cover open area with a dry, clean bandage. Do not, I repeat, do not apply heat, heating pad, or hot water bottle. Do not do that. Watch for signs of infection. Signs of infection: redness, warmth, warmth to area, swelling, drainage, pain, or fever. And this can happen at the bottom of your foot. Again, watch for signs of infection: redness, warmth to the area, swelling, drainage, pain, and redness. And again, notify your doctor and dialysis team if the area does not improve within 1 to 2 days. And the reason why they say that, because you have a decrease in blood flow to your foot because of the diabetes, and if you have nerve damage. So that decrease in blood flow is going to decrease the healing process. And when that healing process doesn't go along as it should, it opens up for you to get an infection. And then that's where the amputation comes in. And last but not least, of taking care of your feet, keep active. Very important. To get the blood flowing to your feet, you got to keep active. Okay? Again, keep active to get the blood flowing to your feet. Very important. Put your feet up when sitting. If you're sitting down, put your feet up. Don't cross your legs for a long period of time. Don't smoke if you smoke. Smoking damages all blood vessels, even those that supply your feet. Walk as much as possible. I'm telling you, that's very important. Walk as much as possible. Be sure to wear comfortable shoes and check your feet after walking for redness or signs of blisters. So that's is the end of the education for taking care of your feet. And now I'm going to talk about, and this is very important because this is your lifeline. And if you haven't shared this video, now is the time to share it because thousands of people, thousands who have dialysis have a arteriovenous fistula. And those people need to be watching this show right now at this point. You know, we already took care of the diabetes education, but right now, if you have a fistula, you need to tune in at this segment right now. And I don't know at what part of the show it's in. At the 41-minute mark. Okay? Is that Yep, we're at the 41-minute mark. You tell people tune in to this broadcast, whether it's after the broadcast, right now, tomorrow, whenever, and go to the 42-minute mark and hear this if you have a arteriovenous fistula. All right, here we go, guys. If you have an arteriovenous fistula, which thousands of patients do who undergo the process of kidney dialysis, this information is for you. 1, do not allow blood pressures to be taken on your fistula arm. You may already know that. Some people may not know that. They may go to the emergency room and they want to take your blood pressure. And if you don't know, especially if you're new to dialysis and no one told you, and if you have a fistula, you may let them take a pressure in your arm. So do not allow blood pressure to be done in your fistula arm. 2, do not allow anyone other than dialysis personnel to do needle sticks in your fistula arm. No one else. No one else, not even EMS, not even hospital people. No one should be touching your access other than dialysis personnel. Do not wear tight sleeves, jewelry, including watches, or carry heavy objects on your fistula arm. And most importantly, do not sleep on your fistula arm if possible. 4, feel for the thrill, as our guest Sorrell last night said, feel for the thrill or buzz 2 or 3 times per day. So if you have a fistula, you just want to check every so often to make sure it's working because it can stop working. If your fistula begins to bleed, and that's what I was talking about in the beginning of the broadcast at home, if it starts to begin to bleed, apply firm pressure over the site with the clean gauze pad until it stops, either that's at home or in the unit. Do not press so hard that the blood flow through your fistula stops. You should still be able to feel the thrill or buzz while you are holding pressure. So when they pull out the needle, don't press it so hard that it compresses it where it's going to stop the movement of blood, okay? Very important. If you notice sudden swelling around your fistula, hold firm pressure over the site, over the stick site until the swelling stops. So that means if you get an infiltration, you want to hold the swelling around that fistula, okay, until the swelling stops. You should still be able to feel the thrill or buzz while you are holding pressure. Check your fistula daily for signs or symptoms of infection. What signs and symptoms of infection? Redness, warmth, swelling, drainage, or pus, fever or chills, pain or tendency. Do you see the common um, signs for infection just with diabetes? If you have an infected foot, some of the same similar symptoms. So infections all mimic pretty much the same symptoms: redness, warmth, swelling, drainage or pus, fever or chill, pain or tenderness. Call your doctor or unit immediately if you cannot feel the thrill or buzz while you're at home. If bleeding or sudden swelling is not stopped after holding direct pressure for 30 minutes. If you notice any of the signs of infection that I listed, redness, warmth, swelling, drainage or pus, fevers or chills, pains or tenderness. If you notice that at home, you need to call your doctor immediately. Wash your fistula arm 2 times a day with an antibacterial soap. I repeat, wash your fistula arm 2 times a day with an antibacterial soap. Exercise to mature your fistula should be started when your doctor or dialysis nurse tells you to. So if you get a new fistula placed in, they want you to start exercising with one of the balls, and we have them. They kidney squeeze balls, and I wish I would have had one right here, but we sell them for $5 donation. And let me go get one. We have them here, kidney squeeze balls. If you know somebody who just got an access, a fistula, we have these for $5 donation. Cash App, I'll put it up if you want one, and we'll send it out to you free of charge. I mean, well, not free of charge, but you send us the Cash App of $5, the postage will be paid for. But and then donations go to buy more of these so we can give them to people who may want to use them, and you squeeze them. So kidney squeeze balls, we have them. $5 donation. I'll put the Cash App information up at the end of the show. Let me see. So wash your fistula arm 2 times a day with the antibacterial soap. Exercise to mature, which I showed you. They want you to exercise with this if you got a new fistula, so you can build your veins up. That's very important that you get, if you don't get it from us, get it from somewhere so you can squeeze it to build your veins up. Again, we have them for $5. Donations, we will send free to you. And that's how that goes. And they normally say start exercising about 1 week after the surgery when they created that. Created your fistula. If there were any problems with the surgery, it may be longer before you can safely start exercising your arm, but you won't know until the surgeon says you can do it. So Never begin exercises without the dialysis team's okay. Exercise, meaning with this, should be done 3 to 4 times per day on your non-dialysis day. So if you just got a new fistula, exercising it like this 3 to 4 times a day to build up your fistula. The exercise as is followed. Check your fistula for signs of infection and for the thrill or buzz. If you find any problem, do not do the exercise and call your doctor. Apply a light tourniquet 4 to 5 inches above the elbow of the arm. You should still be able to you should still be able to feel the thrill or buzz when you put the tourniquet on. If you put the tourniquet on, don't put it on tight like you want to cut off the flow, but like a light tie, and you should still be able to feel the buzz or the thrill. And then apply a warm, wet washcloth to the fistula during the exercise. So they suggest then we'll put a warm washcloth on your fistula while you're doing this exercise like that, pumping it 3 to 4 times a day. You can sit down, watch TV, and do this. If you're reading, if you're driving, somebody driving you around. Also, with the light tourniquet and washcloth on the fistula, squeeze a rubber ball or roll. You can even do this with a rolled up washcloth as well for 10 to 15 minutes, alternating squeezing and relaxing your hand. And what should be happening when they stick in your arm? The nurses and the techs should be rotating these sticks. You know what I mean? Like they shouldn't be sticking at the same spot each treatment. That's how those bumps, they call it aneurysms, are formed. You see people walking around with the knots on their arm sticking up. That comes from going in the same site um, with these needles twice, 3 times a week. So don't let them stick in your access at the same spot each time. They should be rotating. So that's our Cash App information. We put it back up. So if you want one of these, send the Cash App $5 to Steve B Cash. We'll send you out one of these. Send us your name. And if you want a t-shirt as well, we have Urban Kidney Alliance Silent Killer Tour t-shirts in black. We have the Tamika. We have Urban Kid Sunday Morning Coffee Talk t-shirts. All shirts are $25 donation. Postage and handling is included with the $25. We have the Silent Killer Tour shirts. We have Urban Kidney Alliance, Urban Renal Talk with Tamika and Steve. They got the logo on the back, Urban Kidney Alliance. We also have Urban Kidney Alliance shirt right here. It also has our logo on the back. We also have the original Urban Kidney Alliance, our very first shirt that we came out with in 2014. The original Urban Kidney Alliance. Be aware, get tested. Our very first shirt from 2014, retro, has our website on the back. And last but not least, which we're in the process of doing now, is our Urban Kidney Alliance Kidney Disease Urban American Silent Killer Tour shirt. And on the back, it has the dates and the cities that we're wanting to go to. And last but not least, is our Urban Kidney Alliance tour memorabilia tour pass. These are $7 donation. We send them out to you, and it has the GFR card on the back for the stages of kidney disease. So if you know what your number is, you can look on this card from stage 1 down to 5 and see where you fall into. Very colorful. See the number on the side? 15%. And we got this tour cities on there as well. So that's for $7. If you would like any of the items, again, there's the t-shirt, the pass. Just send your donation to Steve B. Cash. So Rosemary was unable to connect. We're going to reschedule her show at a later date. Next week, we're definitely going to have a good show. We're going to make sure that everything is set in place so we can have the show again. If you would like to become a guest on our show, please send us your story through our messenger and we'll pick you. We just want to spread kidney disease awareness. We know every people that's going through this, they're not alone. There's other people that's going through the same thing or a lot worse, but we need to get this information out, let people know that kidney disease is loud and clear. We can't stand to be behind the shadow anymore. This disease is the ninth leading cause of death in the United States. You got more people on this, on the kidney transplant waiting list than any other list. So we need to spread this awareness and stop, being quiet and going to the centers and going to sleep and letting them take over our care. You need to be awake. You need to be mindful. You need to take hold of your treatment. Know what your treatment is. Know what your orders are. What's going on with your treatment, and live a good quality life in spite of what's going on. Because if you don't, they win. And what I mean by they win is that you'll be set in this automatic thinking of just going to dialysis, going to doctor's appointments, and thinking that your life, this is all your life is dealt, and this is it. But that's not the case. You can still travel. You can still do what you got to do. You just need to be in front of this disease and make sure that you're taking care of things that will allow you to do the things that you want to do. So again, if you're watching this, if you're rich, if you're poor, you're black, you're white, it doesn't matter. We all have something in common, and that's this kidney disease. Yes, myself as well have kidney disease. I'm in, stage 1, but it could go to stage 5. I'm not immune to that. So we have to get loud for kidney disease and not just continue to be on Facebook. It has to go beyond Facebook. So I encourage you, if you don't like any of the items that you saw, I encourage you to just donate to our ministry if you can, to send us across the United States, spreading this awareness and copying and reproducing more educational material to give to the masses. So until Tuesday, we hope to have a show Tuesday with Jerome Espy and Bert Whitehead, uh, two friends that met in the church, and one is going to give the other a kidney transplant in December. So until Tuesday's show, take care. Thanks for watching. Share this video. Share it, share it, share it. I encourage you to share this video to raise awareness for kidney disease. Thanks for watching. Have a good evening. Good evening.